Hello everyone, I'm Dr. Soumya Chakrabarty, consultant orthopedic surgeon, R&T Gore Hospital, Mukundapur. Today I'm going to talk about the QVIS robotic system which has been installed in our hospital 2 months back. So this is a fantastic system. I'm just going to show you how it's going to operate in a very small video. So we actually have 3 components in this QVIS robotic system. First is a surgical planner. I'm just going to introduce you with the main components of the system. First is a surgical planner, which is actually a computer, but okay. And the second one is a main console, and the third one is an optical tracking system. So this is basically a camera which captures the infrared waves. And thirdly, I'm going to show you the active robotic arm, which cuts the bone. So this is the active robotic arm. So I'm just going to tell you about a few details about the system. First is a surgical planner. If I just come close to the system, tomorrow actually I'm gonna operate on a 72-year-old gentleman for whom I have just done the planning today. So after the planning, there are multiple small things, small details. I'm just not going to talk to you about that. But after the planning, this is actually going to show me the final planning. So the implant size, the resection depth from the femur as well as the tibia, and the component rotation and the final alignment. Everything is shown in this small screen. Okay, so this is basically the summary of our pre-operative planning. So before we start the surgery, we actually know the implant size, in which position and what orientation the implant is going to be placed. So there is a provisional planning, and finally we generally see that our plan is generally implemented, but we can actually change it at every step of our surgery. So when we start the surgery, first we put the bone markers. Okay, so these are basically 2 pins in the femur as well as the tibia, where we put the ball markers. So the ball markers give the detail about the patient's anatomy to the optical tracker system. So this basically captures the image from the bone of the patient. Okay, so that image generally comes to our main console, and the main console it basically processes every detailed anatomy of the system. So after all the registration and everything, we get to see that what will be the orientation of the component and like how much we are going to cut and all. So these are basically 2 feedbacks. One is from the image and one on the day of surgery from the patient's bone. So this whole information is processed in our main console, and finally it shows that how much cut we are going to do and in what orientation and like what angle we are going to do it, and it has got a very sub-millimeter accuracy. If it cuts 8.4 millimeter, it will exactly cut 8.4 millimeter. It cannot be 8.5 or 8.3. So this much of accuracy is there in our system. So after processing all the information, and then it shows that how much will be the gap in the flexion as well as the extension. So like whenever we are bending the knee, how much is going to be the gap, and whenever we are straightening the knee, how much will be the gap medially as well as laterally. So we can basically change the orientation of the implant, the orientation of the component, like the angles of resection, the measurement of resection we can vary, and we can finally balance on like all our resection medially, laterally, in flexion, extension, as well as the limb orientation, whether it's in varus or valgus or the flexion deformity. So everything is corrected actually before the cuts. So like before the robotic arm cuts the bone, everything is decided on the screen. So this is the beauty of the whole robotic system, that is extremely predictable compared to our conventional knees, where we actually cut first, then we check whether it's fine or not. So this is the basic difference between a robotic and a conventional total knee replacement system. So after all the things are processed here, and we confirm okay, and we confirm that please go ahead, actually this third component of our system, the robotic arm, which comes into play. So this robotic arm which we can see here, it can approach the bone or the knee of the patient from any angle at like any orientation, and this has got a fantastic budding or milling system as well as an irrigation system which actually pours water into the knee. So this water basically helps into dissipating the heat which is generated during budding of the bone. So this whole robotic arm takes care of all the cuts. This is what we call edge to edge cutting, which is specific to this knee system, that it actually cuts the whole femur and the tibia. No other instrument is required. The robotic arm will take care of everything. So after the robotic arm cuts everything, we generally place our trial component over there, and we actually do the final gap checking. Okay, and after we are satisfied with the trial component, then we move to the final implantation. So this actually ends our surgery after putting the final implantation, and we have got a fantastic post-operative rehab and pain control protocol. So this is also like helps the patients a lot. So this is actually a small tour of the whole robotic system we have got here. So thank you all. Stay healthy, stay happy.